I work for Steel Partners as the new wellness program manager, and Amy is your representative on the Wellness Council. So we've had a chance to get to know each other a little bit, and I'm so excited to be here because I haven't been to Casco yet, and we do so much talking about, like, you know, what would everybody be excited about? I don't think it's opioids, but but there's a lot of other things that are going on. But actually, you know, we never know. So I will admit that today's topic is probably a little bit heavy, but we'll do our best to kind of appreciate the impact of having this discussion. And then I promise that someday I'll come back with something really fun to talk about. So this presentation that I'm about to give to all of you today is part of a larger strategy to have an impact on the opioid crisis in the US. It's really important to the leadership team at Steel Partners. As a matter of fact, Warren Lichtenstein, who is the CEO, he has become incredibly involved in a lot of efforts to make a difference in his local community and local communities all over the country. We watched a film that he helped produce through the Wahlberg Foundation, the Mark Wahlberg Foundation. They're family friends, and they produced a movie called If Only that they are taking to teen centers all over the country, and they're doing these big events at various places. We went to one of their events in West Virginia, actually, which is an area that's been very hard hit by the opioid crisis. And so, you know, he's a guy that is really putting his money where his mouth is to make a difference. And one of the things that I really like about this program today is that it's a peer-to-peer program. So you're gonna see, this is only the second time I've ever given this presentation. Tommy's gonna give the presentation for the first time this afternoon. And it's something that anybody in the room could give. So you'll see me, normally I don't like to read off of things, but I might read a little bit just to kind of show that this is an easy presentation to give and can really make a difference. And I want to start out by sharing a personal story. So my godmother died of Alzheimer's disease a couple of years ago, and my uncle was incredibly involved in her care, and they are big community people. My uncle owned a garage where he fixed cars for a local community, and his father before him was the person that owned that garage, and everybody knew who they were, and everybody loved them. To the point where there was a time in my life where I was working down at Disney World in Florida, and I randomly ran into a guy who was like working in maintenance, and we had been chit-chatting, and he was like, oh, I'm from Massachusetts too. I'm from Leominster. And I was like, oh, no way, my uncle's from Leominster, and he owns a car garage. And he's like, wait a minute, is it Cody's garage? Oh my gosh, your uncle helped me out at a time of need. You know, I didn't have enough money if my sister didn't have a car, and he gave us tires for free, and he did all this stuff. He really took care of us, like big members of the community. So, you know, this happens, my aunt gets Alzheimer's, my uncle is like full-time caring for her, and he put the care of the family garage in my cousin's hands. And my cousin, unbeknownst to him, had had a back injury playing hockey when he was in his early 20s and had become addicted to opioids. And so while my aunt is dying, he was stealing money from the family business. And they had to sell their family business because they couldn't depend on him to be there taking care of it. And that was incredibly hard for my uncle at that time, because that's the time where you need all of that family support, you need everyone together. And his addiction just didn't allow that to be. You know, he was another person in our family who was sick and that needed caring for. And unfortunately, when it comes to addiction, sometimes that caring can feel not a lot like caring. And so he moved with his wife and his young son to Vermont and got a job at a garage up there. And this time, when he started stealing from the garage, it wasn't a family member that owned that garage, and he got arrested. And so he, you know, had all of the court fees and all of that. Fortunately, he didn't go to jail that time. Again, he got lucky. But it was a big wake-up call, and his wife realized that she needed to leave him because she was enabling him. And he was one of the lucky ones that when he got into recovery this time around, so far, he's been all right, and he's now living up in Bennington, Vermont, and doing okay. But it's one of those things that you're always on edge because you just never know how it's going to come back around and get you. And, you know, this is just one person in my life. You know, my cousin, who I'm super close to, who's just a really loving and wonderful guy. He's so great with his son. He's so loving towards us, just great sense of humor. And yet you're like, God, I hope this time that this disease doesn't come back and like get him again, because things are going so well. So that is why this matters to me, because like, maybe when he had that back injury playing hockey, if he had just known what some of the risk factors were, then maybe we wouldn't have ended up here. Like maybe his doctor would have made a different choice with him in that moment for how to care for his pain, and it would have saved our entire family a world of pain. But also, like, maybe we'd still have that family business. Maybe my cousin would still be living close to us where we could see him every day instead of living, 5 hours away and only getting to come to family events every once in a while. Like, so that's why this matters to me. So the presentation that we're giving is called Generation RX, and the title comes from two different sources. One is a book that was written by a doctor, and his name was Dr. Greg Krister, and the concept of Generation RX is that we are a generation and a culture that takes prescriptions. You know, it's normal to I've got a headache, I'm gonna take some Advil, and I've got a sore throat and I'm gonna go get prescribed some antibiotics, and we're a drug taking culture. I'm sleepy and I'm having trouble sleeping, I'm gonna take some sleeping pills. Anxiety, we take pills for that. Like we're a drug taking culture. So his book is about how that culture is affecting the downstream of some of the prescriptions that can be problematic. So that is the title. And the second is that this is also, so Steel Partners didn't develop this program. This is a program that was developed between the Ohio State University College of Pharmacy and the Cardinal Health Foundation. And so it's the title of their overarching program. They have lots of resources. I'll show you the website by the end of the presentation, and you can go on and check it out yourself. They have resources for church communities and senior centers, teens, so their whole Generation RX program is something that they've launched to try to make a difference. So the program today is that we're going to discuss the scope, causes, and consequences of the misuse of prescription drugs. We're going to have 4 key messages that can help with safe medication practices. And then we're going to talk about how you can take action within your own home. I have some handouts that are either action steps that you could take in your community, but we also have a pamphlet that we're all going to go through together that is something that is for you to keep in your own house and do with your own family. So this presentation, you'll notice, it's not just talking about opioids. We're going to talk about a number of different medications, but I really feel like we want to highlight opioids because they are uniquely addictive and uniquely problematic. One of the things that just shocked me was that 66% of drug overdose deaths involve an opioid. And I think when I step back and think about it, I get that. But that means that 47,000 people a year die from a drug overdose that involves opioids, and that makes it in the top 10 causes of death in the entire US. And so it's like right up there with some of the other big guys. And so that's why we want to highlight the importance of this. And so back to the overarching conversations, Generation RX, we take Advil for our headaches. As a matter of fact, medications can help us. We live longer and healthier lives now than at any other point in history. Medications can increase our life expectancy, and we are preventing and curing a lot of illnesses and relieving all kinds of troublesome symptoms because of the medications that we have. It's very understandable why we are a drug-taking culture. But that's useful to us only as far as when we're using those medications as directed by a healthcare professional. And I know a lot of people who are like, well, but my doctor prescribed that medication to me. And that's true, but one of the issues is that we have to help our medical professionals be able to prescribe us our medications properly, and if we aren't sharing with them all of the information that they need to make that prescription and write it appropriately for us. So like with my cousin, that doctor obviously didn't know all of the risk factors that he had, and he didn't know to share all of that with his doctor. And that meant that prescription wasn't written properly for him to be able to follow it properly. In addition to a lot of other cultural things that we do with our medication that seem normal, but actually aren't. So, here are 3 scenarios. And now you guys are gonna have to participate. So you can shout it out, like, which of these 3 scenarios depicts prescription misuse?
All of them.
All of them? All of them? All of them? You guys are so smart. Yes, all of them. So taking more than what's prescribed. Like, how many of you guys have like been like, oh, today my headache is extra bad, and so I'm gonna take 3 ibuprofen instead of 2? Right?
No one's gonna do that.
Yes.
We wouldn't do that here in Canada.
Which something like with ibuprofen most of the time is not a big deal, but other pain medications are the same, and especially things like opioids, where the effect, like that pain relieving effect, changes with time. Opioids are not really a very effective medication when they're taken over the long term, because of this very thing. You know, it's like alcohol, right? The first time you ever drink, you know, you get through half a glass of beer and you're like, woo! And then after a while, the effect is not as powerful. And so now it takes 2, 3, 4, 5, 6 drinks to get the same effect. Opioids are very similar. And so when somebody is having physical pain and they're trying to relieve that pain, you know, they're like, it says on the bottle, only take 1 every 3 hours, but you know, my pain's really bad today, I'm gonna take 2. And because we do that with a lot of other medications, even though we probably shouldn't do it with those other medications either, it seems normal. Sharing medications is, so this is something that is actually most people who get addicted, especially teens who get addicted to opioids, get their first pills from their own homes, from their parents' medicine cabinets. But also, they probably don't realize that it's an issue because, you know, maybe one time their mom's friend came over and she was having back pain, you know, I pulled something in my back, and mom was like, I've got these pain pills, why don't you just take one and you'll feel better. Like, the intention is very good in that moment. You have a pain pill, you want to help your friend who's, you know, having trouble walking today because they pulled their back out, and it seems normal to share medication. And we do it with non-prescription medications all the time. Oh, I've got Tylenol in my purse, let me give you some. Like, and so that seems normal. And then having a medication with alcohol, when that's directly, we're not supposed to do that, particularly with opioids, but a lot of medications you're not supposed to take, sedatives and things like that. And I'm reminded when I look at this one, so a couple of people in the room who were hearing me talk earlier, and then I think I said I worked for Disney. But before that, my first acting job after I graduated from Syracuse with my musical theater degree, I went and I worked at Medieval Times in Baltimore, Maryland. And so I was working with a bunch of guys who were like riding horses and smacking each other with big swords and getting injured a lot. And a lot of them were prescribed Percocet and Oxy and all this stuff. They were like candy. And it was super normal for us all to go out after the show and have a beer, and they'd pop a pain pill, have a beer, and that was like, it was so normal, it just didn't even occur to me that that was a problem. Like, I had never read the side of the bottle, and even if I had, since they were all doing it and they all seemed fine to me, you know, I was like, oh, can't really be that big of a deal, can it? But we actually know now that it's a huge deal because people actually die. That behavior was a precursor for addiction, and I've lost touch with a lot of those guys, but who knows what they're going through now. What did I do? Yeah, so all of these things are labeled misuse regardless of intention. It doesn't matter how well-meaning you are, it is in fact misuse. And it's an epidemic. So we talk a lot about those big statistics of people dying from drug overdoses. But the reality is the reason that it's so easy for those people to fall into those traps is because it's so normal. All of those behaviors I was just talking about, super normal. Millions of people every day misuse prescription medications. It's cultural. But it for the people who are represented on this chart, that culture makes a difference between life and death. So these are overdose deaths. Total overdose deaths are represented here in this blue line. Any opioid is this line. But the one that feels the most alarming to me is the green line, and that's the synthetic narcotics, mainly fentanyl. So it's extremely expensive to be addicted to pain medication. Like prescription opiates are very, very expensive to get your hands on, especially after you're no longer getting them prescribed from your doctor or covered by your insurance. And so a lot of people who become addicted are turning to these synthetic alternatives, and they are even more deadly than the prescription medication themselves. And so even though we're seeing like a little bit of flatline on things like prescriptions and heroin, we're seeing a big uptick in the synthetic narcotics. And that's very scary. And it affects all of us because millions of people are behaving as though the way we take our medications is normal. What we're seeing is that this epidemic doesn't have a face, it doesn't have a race, it doesn't have a gender, it doesn't have a financial demographic, it doesn't have a neighborhood that gets affected more than any other. This literally affects all of us. They're having programs with 12-year-olds who are encountering some of these medications for the first time. I have a friend in Boston who worked in an arts program for kids that were dealing with addiction, and by the time they're getting into this program, they're like 15, 16, which meant that they first encountered these drugs when they were 11 and 12 years old, which is terrifying. But there really is no stigma. And so I think we have a picture in our minds of like who a drug addict is and what they look like and what their parents must be like and how they live their life. But the reality is that we're all vulnerable, and it is largely due to the way that we both prescribe medications and the way that we take them. So there are several factors that are fueling this. Our community is vulnerable to the misuse of prescription drugs because we have this drug taking culture, as we've talked about, and we have easy access because we're using medications at unprecedented rates. There are some efforts in various states to try to reduce the amount of these prescription medications that get out, but it's still the norm. We haven't gotten there yet. And there's a lot of misperceptions, like there's a lot of misperceptions about what's legal, about using your medications. People don't realize that some of the behaviors that we're engaging in, you could actually be prosecuted in certain situations for those behaviors. And so we just don't put a lot of weight on it. Prescribing practices. There's some doctors who are really waking up to the dangers and asking the right questions, but there are a lot of doctors who aren't, my boss, for example, told us a story at the wellness meeting about how when she took her daughter who suffers from anxiety to get her wisdom teeth pulled, the doctor didn't even ask anything about that and wrote her a prescription for an opioid. And fortunately, Sarah was like hiding it in the back of the bathroom cabinet, locking it up, and like made her kid take Tylenol. But that was exactly the right decision as a parent. But maybe somebody needs to have a conversation with that dentist, So there's a lot of reasons, and they're all very understandable reasons why we have this problem, but there are serious consequences. There's serious consequences in our communities. So I'm gonna stop just for a minute, and I'm just gonna throw it out to you guys of how this might impact your community, or how you see this culture and all of the impacts from that showing up for you.
I don't know. I've just seen recently a lot of drug interaction deaths.
Yes.
Where a doctor will prescribe or change someone's medication, and 24, 48 hours they're gone. Actually, in the last 3 months, I've seen that happen twice.
Oh my gosh. Yeah. And like that's a prescribing practice issue, right? And but also I think back to like my grandfather who moved here from Lebanon, had very old world views of like the doctor is God. And he should know all, and whatever he says, I'm going to do it. And do you think that my grandfather would ever share anything with the doctor? No, he must know by looking at me magically what's going on. Like, you know, you don't talk back to the doctor in those cultures. And, you know, my mom, when he got older, my mom would go in and drive him crazy, you know, with her list of questions, and he's, you know, embarrassing him by asking or sharing, like, Dad, tell him about the thing. And he's like, no, you know, but like, comes back to like knowing even what to share. Like maybe that doctor wouldn't have prescribed that thing if they had known, you know, if the person being prescribed had felt confident enough to just say what they were taking or what else might be going on in their life. Sure. Yeah. That's
I think
scary.
that's twofold. I think it's a generation of, like you said, we don't talk back to the doctor, we just listen. We're not there to tell them things. And I think the second part of that is that we're also now a culture that sees multiple doctors.
Yes.
Right? Before we used to see one doctor, that doctor always got us in when we needed to. That doesn't happen for us. I mean, I'll have to see a practitioner or whoever's available who can get you in the next month, urgent cares.
Yes.
So we're seeing multiple.
Yeah. And like having just moved, I'm thinking, my new doctor doesn't have any of the paperwork from my old doctor, and to get the paperwork from my old doctor I have to call like 18 different people and hope that it gets faxed over, and that when it gets faxed over the right person picks it up. And like and I had surgery with a scar here, and I had to physically take my records to the hospital myself. There was no automatic anything going on there. Yeah, absolutely.
I think there also needs to be additional legislation each state's working on about sharing information on prescriptions, so you don't have someone hopping from doctor to doctor to doctor, and they don't realize you've already prescribed that same medication 3 times in the week.
Yes.
And for some reason, Missouri's dragging their feet on that, and I don't understand why.
Missouri.
Well, there's some counties that do, and then there's some counties that don't in Missouri. It's not a state thing. It's kind of, it's very odd, but I don't know why there's such pushback, but there is.
Yeah, and the legislation moves so slowly. You know, so we're working on a project through the Wellness Council to upgrade all of our safety kits, our emergency response kits to include Narcan. We think that it's a good, smart thing to do, whether or not like overdose at work is an issue. It raises awareness, makes us further prepared the same way we are with an AED. In the amount of time, in like the last 4 months that we've been heavily working on this project, the legislation about how you can get that prescription written for your workplace has changed. Fortunately, it's moved in the easier direction, but like when we started, it was one thing and now it's something else. And but it was for all of the people that we've been working with who have been counseling us, they were like, finally, because like for years they've been trying to change the way that Narcan gets prescribed because they know how it could really save lives, and they were making it so burdensome for companies, but it like took like years. You know, and we have been talking with people at Amtrak, because Amtrak just implemented having Narcan on all of their trains. And the process that they went through took them 5 years to be able to implement on all of the trains. And we kind of scooted in on the tail end of that, but they have been trying to make this process easier forever. And then we got lucky that, you know, finally after all these years, they are, you know, making that a little easier to do for multi-state companies. But man, it's like, come on, like this just makes so much sense. Like,
It does.
so crazy. Yeah. Anybody else before we move on? These are all really good thoughts. And like one of the other things that occurred for me is like what I encounter when I go to the doctor, I'm like their worst nightmare, because I'm like Dr. Google, then, you know, and I come in with like all of my recommendations of what I think is wrong with me, right? Yeah. And the doctors like half of them tune out. They're like, oh my God, another Dr. Googler. And like, you know, like just let me tell you what's wrong with you. And I'm very much like, no, I will tell you what's wrong with me. And we eventually strike a balance. But like there is that other side of that culture of not only do some people not feel comfortable telling the doctor information, but there's some doctors who feel like, all right, I'm the doctor, I'm gonna tell you. And that's not true either. We're all humans, you know? None of us is perfect, including our doctors. So in the previous slide, we talked a little bit about, actually, I skipped this. So federal law actually prohibits us from doing things like sharing medication with people, like sharing a prescription medication with a person who it's not prescribed to. It's actually, someone could be prosecuted for that. And the same thing for not taking your medication as directed. So one of the things that we've been talking about, you know, with regards to adding Narcan to the workplace is, what do you do, you know, from an HR perspective if someone overdoses on site? And, you know, does that person lose their job, or do they, like, are they then subject to legal action? Like, what does that mean? You know, we want to be supportive of the person. We've just saved their life. We're grateful they're alive, but like, now what? And what the representatives told us was, well, if they've overdosed, as big as your heart is, they took too much of their medication, and that's illegal. And we were like, whoa, like, really? And they were like, yeah, they can be prosecuted for, you know, having taken too much of their own prescribed medication. They didn't take it as directed. I had no idea. And there, it's not just opioids. There's other examples, like controlled substances include not just Vicodin, OxyContin, Valium, but also things like Xanax, Adderall, Ritalin. You know, so it's like the uppers as well as the downers. Like, they're like the kids that are sharing their Adderall medication that they've been prescribed for their ADD with their friends. There are legal ramifications to that, and if something happens to that other child's parents can absolutely take legal action against you and your child. So there's also a social impact. I think back to like my cousin and like how it didn't just affect him, it affected his son, it affected his now ex-wife, it affected my uncle, it affected my aunt, who, even though she had no idea what was going on, she didn't have her son there to help her through those last stages of her life. It affected all of the people that my uncle worked for, who, when he had to sell the business, now had a new boss. They weren't working for that same family company that they had for multiple generations in some cases. It affected that business, it affected the next business. And that money loss affected people's income. It affected the people in that community who now maybe have to pay more for their garage service if they're the only local people in town. I mean, it affects everybody. And it's really tough, because at the same time, we know that he's not doing it on purpose. It's a disease, and it's a systemic disease, because it's the circumstances that set that up are cultural. It's something that we all do and all contribute to. And also, that financial burden goes so much beyond just that immediate ripple. Let's see. So what the details here say that in 2011, the annual cost of prescription opioid misuse on the U.S. economy was close to $53 billion. And $42 billion of that was in lost workplace productivity, of people having to call in sick, or, you know, not being fully present at work, medical bills, $8.2 billion in criminal justice costs. So all these legal things are very real. Like, people get arrested, lawsuits, and $2.2 billion that we've invested in drug abuse treatment, and $944 million in medical complications. We have a doctor that works with us. He's wonderful, Dr. Rob. Hopefully you guys will get to meet him sometime. He does some workshops for us. But he's like the most gentle, loving guy, and his daughter is addicted to opioids. And he finally had to beg the judge to put her in a rehab facility, like a legally enforced rehab facility, about like 7 or 8 months ago, because he was terrified that she was going to die. And because she's already had open heart surgery as a result of an overdose and the effects that the opioids are having on her system. And even despite having had open heart surgery and almost died 3 times, she still got arrested again for misuse. And he begged and pleaded with the judge to sentence her to a facility, and he did. And he's so grateful, as horrible and sad as it is. And so, you know, and of course, those health issues are the most tragic, right? When you actually lose someone, or when someone loses their ability to function, and to recover. Like, that's the hardest impact is when the worst stuff actually happens. But there's good news. Oh my God, it's been so heavy. The good news is this is cultural, right? Which means that we can make a difference. We can change it. We can do something about it. And it starts in rooms like this, with presentations like this, that anybody can give. All of the notes, anything you might want to say is like right here. And like, we can get it. We can talk to people about it. We can change our physical behavior. We can deal with our own medications differently, even in circumstances where we don't feel like it's a big deal. We can model different behavior. So, I mean, like, does anybody see, even just from what we've talked about, like things that you could do differently or talk about differently? Anyone? I showed up here today to give this presentation. That was something I did differently. Flew across the country. Anybody? I'll give you some ideas coming up here. Maybe the brainstorming will get going. All right, so there are 4 concepts that we have here that we're going to talk about in detail that can help make a difference just in reshaping the culture. So reshaping the way that we do things. So number 1 is we can take responsibility for only using the medication as directed on the thing. Simple, right? Don't take an extra one if you're feeling tired today, or take all of the antibiotics as directed and then get rid of the bottle. We can model that behavior. Our kids are watching us for sure, but also our peers are watching us. Don't share or take someone else's medication. If you're feeling bad and your friend very lovingly offers to share their meds with you, just say no thanks. No big deal. Don't do it yourself. Don't let your kids see you be like the loving friend helping their other friend out. It's fine. Your friend will be okay. Send them to their own doctor. Keep your medications in safe storage. This is a big one because we know, especially with, and it's not just the kids in your own home. Like, addicts know to go looking when, gotta go to the bathroom, and then they're rifling through your cabinets. So if you do get prescribed a controlled substance, or you do have, one of your kids is on Adderall or, anything like that, which is fine. There's nothing wrong with taking the medication if you need it. That's, like I said at the beginning, we're living longer, and that's a good thing. You're more functional, that's a good thing. But keep them safe. If you have a lockbox or, a place where you keep those controlled substances that where they are, how many you have, that's another thing. Count the pills in the bottles. So keep them safe. The next piece after storage is disposal. When you're done with the prescription, there are certain ways that you're supposed to get rid of them. So one of them is drop boxes. They have them at a lot of pharmacies. A lot of hospitals have drop boxes. Police stations have drop boxes. You can take it, pop it in the bucket, and then you're done. Twice a year, there is the DEA National Take Back Day, where a lot of places will open up temporary drop boxes just to try to accommodate the amount of medications coming in around our communities. So there are even more facilities a couple times a year. Also, if you don't have a drop box near you, in a last resort, there are ways that you can get rid of your medications right from home. So step 1 is put the medication, mix it in with like something like cat litter is a great example, like used cat litter. Nobody's gonna go picking through the used cat litter to then put whatever it was in their mouth. Other coffee grinds, right? Like fines. Can you imagine?
No.
Then you seal the bag and put the sealed bag in the trash, and then the last step is really important. Pull the label off of your bottle, and then recycle or throw the bottle in the garbage and dispose of the label separately. Tear it up in small pieces, and throw that away separately. We actually make this even easier for our employees at Casco because Steel Partners has provided a product called Deterra. And Deterra is a baggie, that you can cut open the top, you put your medication inside, you fill it up halfway with water, seal it, shake it, throw it in the garbage. And what doTERRA does is it chemically alters the drugs inside and renders them inert. So even if, let's say that the bag spilled open and like got into a water source, it wouldn't pollute the water, it wouldn't, and if someone opened it and went in there, even if they could get the pill out, it wouldn't have any effect. And so we've provided those bags for free to all employees, and I think Amy
HR still has some.
still has
If
them.
anyone has any.
So, and they're cool because they don't have an expiration date. You can bring them home even if you don't have any medication in your home right now. If you get prescribed one at some point in the future and you're done with your prescription and you want to get rid of it, you can do that, and it will stay good in your cabinet, no problem. And that's, I think having this conversation is important because I think a lot of people, their instinct is just to flush it. But we actually have a problem with those opioids getting into our water stream and all these other drugs that are showing up in things like, when they test grains and the like farm products. So especially like out here where so much of our food is grown, like it's such a big deal.
Yeah.
There are some medications that are okay to flush, but it would say it on the label if it was. So usually there should be some sort of disposal information on, like when you pick up the drug from the pharmacy, there's disposal information. But what's nice about doTERRA is if you happen to, for any reason, come across something that didn't come from a pharmacy, you can feel safe and secure of dumping it into that bag and just getting rid of it. And then model safe medication practices, like do these things, and if anybody sees you, they'll start to see, oh, that's the normal way to do it. We start to shift the culture. So as I said before, this, like, if you are brave like us or not brave, it doesn't matter. Like, I think this presentation could be effective even if you were just sitting with 2 people at a table and you all just read through the material together. This is meant to be a peer-to-peer presentation. Anybody can give it. And like I said, on their website, generationrx.org, there are presentations that are geared towards different communities and different demographics. And what's cool is it comes with like handouts, frequently asked questions. It will tell you, like, you don't have to be able to answer any questions about opioids or know anything about it. All of the pertinent information is on these sheets. So I'm gonna hand out these take action handouts that Amy so graciously printed for us. And then I'm also gonna hand out this. This is the last thing we're gonna do today. So just educating other people, deciding that you're gonna take this on in your own neighborhood. Awesome. So as we're handing that out, I'm just gonna say how Steel Partners is taking action. And so we participated in the DEA Take Back program. There was like over 900,000 pounds of medications collected at the one lab in October. And I know, crazy, right? And we participated in that. We had the doTERRA bags out. We rolled this out, and I'm thinking as the years go by, we'll be even more active and visible of doing that. We have this Generation RX presentation, and we have this handout in front of you. And additionally, not on this, we are, like I said, upgrading our emergency response kits, and also working with the Wellness Council to think of other ways that we can get involved in our local communities. Rolling out other education programs, life-saving education programs, like teaching people how to administer something like naloxone or Narcan to save someone's life. And so, it's step by step. We'll see how it goes at various places, but already, like they were talking with Steel Sports, we have a soccer camp that Steel Partners runs, and they have like 300 coaches that are all over the country. And even though they might not have an issue with like the kids that they're coaching, they're in hotels, and a lot of people are dying in bathrooms, at like the local like 7-Eleven or in the bathrooms at restaurants, at the mall, things like that. And if we have this like field of ambassadors running around the country, like how amazing could that be, and how powerful could that be, ready to save a life. One of the Steel Partners board members is an advocate, and was showing everybody at the CEO summit his Narcan in his pocket that he keeps just in case. So there are lots of ways that we can get involved, and we're exploring this as a company. But these are the 3 ways that we're definitely taking action now. So what I'm gonna have you do is the black and white folder that's in front of you, if you'll open it up to, to the middle page right here. And if you have a pen and you wanna check this off, or if you just wanna look it over, we're just starting with step 1, check all that apply. And these are potential risk factors. So I'm gonna give you guys a minute to just read through. So is there anything on there surprise you?
No.
I will tell you, I was bowled over when I learned that ADHD was a risk factor for addiction. I had no idea. No idea. And like, I think through all of the people like in my life that have ADHD, and especially the kids, and like, I'm not sure that I would have ever thought, you know, if I was taking my kids to get their wisdom teeth pulled, to be like, by the way, they have ADHD, and I know that that's a risk factor for addiction, so maybe we can prescribe Advil instead of Oxy for their pain. Like, I just wouldn't even occur to me to tell the dentist that that's something that my kid has. Like, I was just, and then the other reaction that I had when I read through this list was like, oh my God, this is everybody. Like, it's like, but like, one of the things that Dr. Rob was telling us about was that even for people who like can be more at risk if they've grown up in an environment where their parents regularly use alcohol to relax and have a good time, and they grow up witnessing that as normal behavior, that they can be more prone to addiction. And I was like, it's just so mind-bending to me. But yeah. All right, so now we're gonna look through the other list. Step 2, it's much shorter. Those of you at home can follow along. So the second list is, okay, we're gonna start the dialogue with the doctor that we can't always depend that the doctor will make time for. And you know what, I don't wanna, like, doctors are awesome, and I love my doctors, and I'm very grateful that they're there, especially in an emergency. But a lot of times I think that they have lots of patients. Many practices, in order to stay open and stay in business, need to see many patients, probably more than they really have capacity to do to stay in business and make sure that our communities have doctors that they can go to. And so if we can come in prepared ahead of time with our questions and our risk factors, that can help the doctor to have better conversations as well. So we suggest that you like do this at home for yourself. You can make a photocopy and do it for your kids or your spouse or your partner or whoever. And parents, aging parents. So actually one of the community that is at very high risk for drug overdose is the elderly. And oftentimes, again, not intentionally, you know, if my mom wasn't around, so my dad also has Alzheimer's, and if my mom wasn't around, my dad would overtake his medication all the time because he just doesn't remember if he took it. So the elderly is a population, so you can do this for your parents so that they have something that they will carry with them when they go to their appointments. The other thing I always laugh about, I'm like, you know, you get a call from the school and they're like, you know, Miss Ingalls, your kid is injured and they're on their way to the hospital. And I'm not going to be like, wait a second, I got to go home and get my opioid pamphlet. Like, so that's probably not going to happen. But there's two things I think are really great about this. Is one, just by doing it, I've now had to think about it ahead of time before the critical moment. You know, when you're in that moment and you're in the ER, you are not, you're like, and you're in pain, or you're someone you love is in pain, you're like, whatever it takes, doc, just make me feel better. Or like, you know, stop. Like, I used to RA for a summer college program, and I will never forget one of our students broke his collarbone and was like literally green. And whatever the doctor would have said to do in that moment, I wouldn't have hesitated. I would have been like, yes, do that. Like, stop this child from being the actual color green. But, you know, so that moment when your adrenaline's pumping or when you're scared is not the time to think through these questions for the first time. Mm-hmm. So getting to do it ahead of time is helpful, but also, like, we all have smartphones now. You can fill it out and then take a picture, and then it's there, and you can pull it up and reference it to help you have more calm conversations under stressful circumstances. Mm-hmm. So that's another way it's useful, is you can take a photo. And then again, just reiterating, if you do get prescribed a controlled substance, take it as directed. And that will make a difference there. It will keep you healthy and safe. And then hang on to the checklist. All right. Ta-da! Does anybody have any questions, comments,